Hey there, I'm Dr. Shannon Gregoire, and I'm a graduate of Western University of Health Sciences and now practice in Massachusetts. It wasn't that long ago when I was studying for NAVLE too. I know how nerve-wracking it can be to tackle these topics. And I'm super excited to team up with Vet Candy to go through some quizzes with you. As we dive into this, I want you to be as interactive as possible. Drop your comments and questions in the chat to participate. We're here to support you, so if you ever need anything, just reach out. Let's get started. Question 1. A 5-year-old Doberman presents with history of exercise intolerance and fainting episodes. Upon auscultation, you note a heart murmur best heard at the left 5th intercostal space. What is the most likely cause of this murmur? A. Pulmonic stenosis. B. Patent ductus arteriosus, or PDA. C. Subaortic stenosis. D. Mitral valve dysplasia. Or E. Tricuspid dysplasia. Take a moment now to think about what answer you choose and drop it in the chat box below. The correct answer is D. Mitral valve dysplasia. Mitral valve dysplasia is a condition that often presents with a murmur best heard at the left 5th intercostal space, which is the typical location for mitral valve auscultation. Answer A, pulmonic stenosis, is incorrect. This murmur is best heard at the 3rd left intercostal space. Answer B, patent ductus arteriosus, or PDA, is incorrect, as this typically produces a continuous washing machine murmur, best heard at the left heart base. Answer C, subaortic stenosis, is also incorrect. This murmur is best heard at the left 4th intercostal space. And lastly, choice E, tricuspid dysplasia, is incorrect. Murmurs from tricuspid dysplasia are heard on the right side at the 3rd to 4th intercostal space. Now let's move on to question number 2. A 3-year-old thoroughbred horse presents with an irregular heart rhythm. ECG shows no P waves and irregular R to R intervals. What is the most likely diagnosis and appropriate treatment? A. Atrial premature complexes and atenolol. B. Atrial fibrillation and quinidine. C. Ventricular premature complexes and lidocaine. D. Ventricular fibrillation and defibrillation. Or E. Ventricular tachycardia and digoxin. Take a moment now to think about what answer you'd like to choose and put it in the chat box below. The correct answer is B, atrial fibrillation and quinidine. Atrial fibrillation is characterized by the absence of P waves and an irregular R to R interval. Quinidine is the treatment of choice in horses. Answer A, atrial premature complexes and atenolol, is incorrect, as atrial premature complexes typically present as isolated premature beats and are often clinically insignificant. Choice C, ventricular premature complexes and lidocaine, is also incorrect. Ventricular premature complexes are identified by premature bizarre QRS complexes. Choice D, ventricular fibrillation and defibrillation, is also incorrect. Ventricular fibrillation presents with chaotic electrical activity and requires defibrillation. And lastly, choice E, ventricular tachycardia, digoxin, is also incorrect. Ventricular tachycardia presents with a run of rapid, regular QRS complexes and is typically treated with lidocaine. Great, now let's move on to question number 3. A 6-year-old German Shepherd is presented with a history of sudden collapse. Physical exam reveals muffled heart sounds and jugular vein distension. What is the most likely diagnosis and initial treatment? Is it A, hypovolemic shock and intravenous fluids, B, cardiogenic shock and furosemide, C, distributive shock and epinephrine, D, obstructive shock and pericardiocentesis, or E, anaphylactic shock and antihistamines? Take a moment now to think about what answer you'd like to choose and put it in the chat box below. The correct answer is D, obstructive shock and pericardiocentesis. The clinical signs are indicative of pericardial effusion causing cardiac tamponade, a type of obstructive shock. Pericardiocentesis is the initial treatment. Choice A, hypovolemic shock and intravenous fluids, is incorrect. Hypovolemic shock is typically due to fluid loss and does not present with muffled heart sounds. Choice B, cardiogenic shock and furosemide, is also incorrect. Cardiogenic shock involves poor myocardial function, often with pulmonary edema, not muffled heart sounds and jugular vein distension. Choice C, distributive shock and epinephrine, is incorrect. Distributive shock is related to sepsis or anaphylaxis causing vasodilation. And lastly, answer E, anaphylactic shock and antihistamines, is incorrect. Anaphylactic shock presents with hypotension, urticaria, and often respiratory distress, not muffled heart sounds. All right, now let's do question number 4. A 4-year-old Maine Coon cat presents with difficulty breathing and coughing. Radiographs show an enlarged left atrium and pulmonary edema. What is the most likely diagnosis and treatment? Is it A, right heart failure and furosemide, B, left heart failure and furosemide, C, pulmonic stenosis and balloon valvuloplasty, D, patent ductus arteriosus and surgical ligation, or E, ventricular septal defect and no treatment needed? Now take a moment to think about what answer you'd like to choose and put it in the chat box below. The correct answer is B, left heart failure and furosemide. Left heart failure in cats often presents with pulmonary edema and an enlarged left atrium. Furosemide is a diuretic used to reduce fluid buildup. Answer A, right heart failure and furosemide, is incorrect. Right heart failure typically presents with systemic signs such as hepatomegaly and ascites, not pulmonary edema. Answer C, pulmonic stenosis and balloon valvuloplasty, is incorrect. Pulmonic stenosis would present with a murmur at the left third intercostal space. Answer D, patent ductus arteriosus and surgical ligation, is also incorrect. Patent ductus arteriosus presents with a continuous murmur and requires surgical correction. And lastly, choice E, ventricular septal defect, no treatment needed, is also incorrect. Ventricular septal defects cause a loud murmur and right ventricular hypertrophy. Small defects may not need treatment, but large defects often require intervention. Well, that's a wrap for tonight's quiz time. You guys did great. Thanks so much for joining us. We'll catch you next week. Have an awesome time and keep studying hard.